So the short answer is maybe. It depends upon the area of the spine and the particular problems that that person has. So bracing can be effective for the postural collapse that's associated with scoliosis. And unfortunately, when a person has had a large fusion, the area above and the area below the area that's been fused gets really stressed. And that area can start to collapse. So many times the patient will come to me and they'll say, look, I had the surgery. I actually had a pretty good result, but now I'm starting to experience some very significant back pain associated with it. And when I had an x-ray, they told me that I'm getting a significant scoliosis in my lower back, and that's why. So in that situation, if it's due to postural collapse, we're going to give the person exercises, scoliosis-specific exercises, and we're going to give them a specific type of brace that will help them to lift into corrected posture. And there's no reason why surgery will prevent that. Thanks for watching. I hope you found all this information helpful. Please subscribe if you'd like to have more information about scoliosis, and don't forget to hit the bell. That'll alert you whenever we publish new information. And if you've got any questions, write them in the comments field, and I'm going to make sure to address them in a future video. Thanks for watching.